way to travel.
This is how the other half live.
Political networks were evaporated overnight.
It is a warning to us to prevent this from happening again.
Enter the world of pop art phenom Keith Haring. He created his art for everybody.
These and other shows from your PBS station are available with Passport on the PBS Video app. Download it today.
What's your next move? Extend beyond your current position or make inroads into a new field through UMBC's professional master's programs and certificates in cybersecurity, data science, biotechnology, and more. Claim your future at UMBC.
We at Sage Policy Group recognize that this is a challenging period for households and businesses. But Marylanders are intelligent, strong, inventive, and entrepreneurial. Eventually, this economy will bounce back stronger than ever.
71 acres in downtown Baltimore devoted to learning, discovery, care, and service. We train the professionals who secure the health, well-being, and just treatment of Maryland citizens. We create the knowledge that cures disease and strengthens communities across the state and around the world. UMB makes the world more just, more enlightened, healthier, and more humane. We are UMB.
State Circle is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
Relief checks on their way.
This emergency legislation will immediately provide more than $1 billion in urgently needed tax relief and economic stimulus.
Medical bills piling up.
She didn't want to leave my brothers and I any hospital debt.
And college athletes score big under new legislation.
We have a bill that would allow student athletes in our public universities to retain the right to use their name, image, and likeness, and to earn income from that.
Connecting Marylanders to their government. This is State Circle.
Good evening. The big story around State Circle this week is a flurry of checks. That's what the state of Maryland began distributing today as part of an economic relief package. State Circle's Charles Robinson tells us where that money is going.
This is a big deal. This is of historic proportions. We have a governor who sees because we all represent the same people. And the fact that we were quickly able to do this says a lot to us.
This emergency legislation will immediately provide more than $1 billion in urgently needed tax relief and economic stimulus for struggling Maryland families, small businesses, and those who have lost their job.
But this is a good day. I am proud to be with the governor as he signs this bill to make sure that all Marylanders know that help is here and on the way. Let us together make 2021 the year of true rebuilding and recovery.
For most Maryland families that qualify for the earned income tax credit, they're going to see about an extra $1,100 in addition to receiving the stimulus.
Robin McKinney of the Cash Campaign of Maryland assists low-income families with navigating tax preparation. She's on the front lines helping those who need help. So what's in the Recovery Relief Law? It includes a number of provisions: tax relief for struggling small businesses and direct grants, utility relief for struggling families. Help is also on the way for schools to reopen, along with payments for tutors to help children who've fallen behind.
The easiest way to take advantage of the 2021 Economic Relief Law is through the Earned Income Tax Credit. If you file for it in 2019, you don't have to do anything. The state is going to send you a check directly to your bank account. If you don't have a bank account, then they're going to send you a paper check.
Overseeing the distribution of these varied payments is Comptroller Peter Franjo.
I know how important these payments are for people right now. I promise you that we're going to process the payments that we are directed to as fast as we can to ensure the money gets into the hands of the people who need it the most.
Is the law perfect? No. The digital divide poses its own problems for people needing help, but it does ease some of the burdens Maryland families face. I'm Charles Robinson for State Circle.
Those with questions about the stimulus money can reach the comptroller's office at 833-345-0787 or visit marylandtaxes.gov/reliefact or email reliefact@marylandtaxes.gov. The state's latest coronavirus report shows a greatly improved situation at hospitals. About 1,000 people are hospitalized with the disease. That is roughly half the hospital count from 5 weeks ago. The death toll in the state still grows, now approaching 7,500 lives lost. And the state today hit a milestone in the vaccination race with over 1 million doses now administered. Appointments remain very hard to get, but supplies are expected to improve. Bills for medical care are reported to be the #1 cause of personal bankruptcies. As Nancy Amata reports, lawmakers are considering new limits on aggressive collection practices for medical debts.
She literally barely breathing. And I'm like, Mom, please. And she's telling me no.
Nick Mostris is recalling the painful last days of his mother's life. She was reluctant to go to the hospital.
She didn't want to leave my brothers and I any hospital debt.
The Harford County resident says it's something she was all too familiar with. There was a lien on her home after her husband's $6,000 hospital bill in 1992 ballooned to $26,000 because of interest decades later.
It quadrupled, and it became so much that my brothers and I, we don't have, that kind of money just to pay something off. And when we did contact the lawyers, they were essentially like, oh, yeah, we know this lien's happening. We know your mother died and we're coming after it.
Mostris shared his story with members of the House Health and Government Operations Committee. Lawmakers are considering a bill aimed at overhauling how hospitals and creditors can collect medical debt.
We're making sure that patients are protected, that people don't end up in bankruptcy and financial ruin because they got sick.
Delegate Laura Charkoudian's bill, which died in committee last year after the session was cut short, would bar hospitals and healthcare providers from filing collection lawsuits if the amount owed by the patient is less than $1,000.
So the hope is then that increases the incentive for the hospital to work on payment plans, to work on other ways of collecting that debt that aren't punitive and stressful.
The bill would also limit interest rates and late fees and prevent healthcare providers from taking legal action or sending information to a credit reporting agency within 180 days after billing a patient.
We want hospitals to be able to collect the money that's owed to them, absolutely. But if we don't put in protections around how they do that, the implications can just be massive.
Bill opponents include the Maryland Hospital Association. In a statement, CEO Bill Atlas says hospitals already have taken many steps to ensure that people who are uninsured or whose insurance coverage has large gaps receive appropriate aid based on demonstrated need. While saying he supports the intent of the bill, he went on to say the complex provisions of this proposal demand careful thought to prevent unintended adverse consequences. One other component of the bill would make it illegal for a provider to place a lien on someone's primary residence or garnish wages if a patient is eligible for reduced or free medical care.
No family deserves to go through and lose their home because of a medical debt, and you're literally grieving while that process is happening. And it's almost, you have no time to grieve because you have to take care of business.
He says the pain still lingers years later. I'm Nancy Amata for State Circle.
There is a new step in the review process for some of the bills making their way through the General Assembly. Our Sue Copen says a racial impact assessment will now be included.
Every bill that gets introduced and considered at the State House is reviewed to determine its fiscal impact and effect on existing policy. This year, the House Speaker and Senate President say that will now include a pilot project to assess the racial impact of bills dealing with criminal justice reform. Prince George's County Delegate Jazz Lewis has advocated for racial impact statements for a number of years.
What they'll do essentially is when we have bills that deal with policing and sentencing reform and probation changes, they will study the issue very quickly to see how it may impact certain communities disproportionately based off of readily available data.
This type of analysis is essential and something that has been lacking for us
Senator Will Smith is the chair of the Senate Judicial Proceedings Committee.
Some of the criminal justice matters that we put forward, how is that going to impact people of color? Is it going to result in more people of color being stopped or pulled over, being incarcerated? Everything. So from incarceration to housing and everything in between, this type of information will be invaluable for us.
Bowie State University and the Schaefer School of Public Policy at the University of Baltimore will be gathering the information that will be used for the racial impact assessment.
We have sociologists, criminologists, economists, we have a data analytics person, and we work together to comb the data, comb the numbers, and really try to come up with some solid data points.
We're looking at data around arrest, prosecution, pretrial data. We're looking about data about incarceration, juvenile services, data that's available about victims, interaction with police officers, data about police forces, including use of force, also disciplinary information.
The information collected by the two programs will be passed along to the Department of Legislative Services, which will incorporate the findings into their analysis of the bills.
Our hope is that if we find that particular bills are going to, let's say, potentially incarcerate or do harm to one community disproportionately, we have the ability and the time during the legislative session to possibly mitigate it. 6
states already require some form of racial impact statement. A number of others are considering similar policies. Sue Copen for State Circle.
Joining us for the Annapolis Face-Off this week, Delegate Brooke Learman, a Democrat from Baltimore, and Senator Justin Reedy, a Republican from Carroll County. You are working together on a bill that would involve student athletes. Delegate Learman, first, what would it do?
Thank you so much for having us today. So exactly. We have a bill that would allow student athletes in our public universities to retain the right to use their name, image, and likeness and to earn income from that. Just like every other student at any college can do already, we want to make sure that our student athletes who are participating in sports retain that right. The second part of the bill is to make sure that we're looking out for the health and safety of our student athletes. We have, unfortunately, over the years, tragically lost some of our student athletes, and we want to make sure that our universities are taking care of our students and looking out for their well-being while they're playing at these schools.
There were some reforms, of course, after the tragic death of University of Maryland football player Jordan McNair. How does this bill expand on that?
Well, this bill creates, for the first time in Maryland law, although not the first time in the country, a Bill of Rights for our students, for our student athletes, to make sure that they have certain rights relating to their health, return to play protocols, their safety issues, looking out for their rights regarding their scholarship retentions if they don't feel that they can play, so that they don't feel threatened in any way, and just making sure that all the right protocols that we know need to be in place are in place for those student athletes.
Senator, what's most important for you in this bill?
Well, certainly the safety of our athletes is obviously a top priority, but what interested, and we have made, as you pointed out, some steps on that, but we want to go a little further with this. What made me so interested about working on this issue, though, is the name, image, and likeness part of the bill is something I've been looking at for a couple of years. There's a big fight at the national level and with the NCAA about this issue. To me, it's the most common sense thing in the world that if a student that's on a music scholarship at a school can go give private lessons and not be in danger of losing their scholarship, why in the world can't a women's lacrosse player or we always think of football players or men's basketball players as being the ones that would make money from this by endorsing products. But the truth is a lacrosse, men's or women's lacrosse player or someone's really good at tennis, if they can market themselves and do camps in the summer and make money, why in the world, particularly when so many of our scholarship athletes at the college level come from low-income backgrounds, why in the world would we not want to let them do that? Hopefully it can motivate some kids to stay in school a little longer too, and even if they're ready to go to a professional level. So to me, it was a kind of an economic fairness issue, sort of free market kind of thing for me. And I think it's where we need to go and will be going nationally. So we want Maryland to be on the cutting edge of that.
Is that an issue with, I was going to ask about the NCAA.
Well, I would just add, to what the senator said, 86% of college athletes live below the poverty line. And, this gives those college athletes the opportunity to earn income. And, just like he said, this may be the only opportunity that a woman athlete in particular, or most athletes have to make any money from their skill, right? And so
True.
at the top of the game, they should be able to profit from that. And, the NCAA, last year, they said they were going to come to an agreement and they were going to work on this issue. They canceled that entirely. They were supposed to earlier this year in January to put out their proposal. They canceled that meeting and they have no plans right now on the table, or they have no plans at all to address this issue.
Yeah, Jeff, that's what really motivated
Yeah.
me to push again on this year, because the NCAA has had, really, this has been an issue. They could have gotten in front of this years ago and they didn't. And they keep waiting for Congress to act. And I'm all for Congress acting. And it's actually interesting. This is a bipartisan effort here. There are some bipartisan things going on in Washington, but again, other states are moving forward, and we wanted to be sure that we were standing up for our Maryland athletes as well. And again, looking at more ways that we can make sure we protect not just the physical safety, but also the mental health safety of the mental health of our athletes.
Is there any pushback from the universities, from the NCAA, and in terms of who this benefits? I wonder if there's a recruiting angle. If you're the next big star in a revenue sport, maybe you're going to think about going someplace that lets you do this.
Why wouldn't you, right? I mean, 5 states already have this law on the books, and the first state goes into effect in Florida. This goes into effect this July. If I'm a coach and I want to recruit somebody and I'm competing with those other states, I would want to have this, right? I would want to say to my athletes, we value your health and safety. That's why you have a Bill of Rights. And we value your ability to earn money from this sport. And that's why we support this. So, the universities, they have their own opinion, and I think they're worried about the NCAA, but, we feel like it's the duty of the General Assembly to step in and to say we have to protect our athletes, and we have to make sure that their financial rights are being protected too.
We've had some great conversations with them, so we hope that we can continue to make progress on getting everybody fully behind the idea.
Yep.
This is way too much agreement for how this segment normally works. So let me ask about something where I suspect there's disagreement, and that's the extension of the new state pandemic stimulus effort legislation to cover undocumented immigrants. Senator Reedy, you just debated that in the Senate. How do you stand on it?
Well, I'm opposed to it. I think we did the Relief Act because we're trying to use limited taxpayer dollars for targeted relief to small businesses, to people who are struggling. And to me, when we're taking taxpayer money and giving it out, which is essentially what this tax credit is, this is a refundable tax credit for people making $6,000 or less in taxable income a year. We need to prioritize. We need to prioritize people who are here legally and citizens that are citizens. And this essentially, not just for this year, it's not just an emergency thing for 1 year, it goes for 3 years, $60 million a year, $180 million of taxpayer dollars going, basically be given to people who are breaking our law and are not here legally. So
I guess I would just add that, of course, the repeated use of these are taxpayer dollars. That's right. These are taxpayer dollars. And we are going to extend the EITC to all taxpayers, because right now there's a group of taxpayers in Maryland who use ITINs, or tax ID numbers, to pay their taxes rather than Social Security numbers. Many of them are legal, some of them are not here legally, but they all pay taxes. And so it's so important that we help and make sure that they're paying into the system. And if they are income eligible, they are owed this money too. I mean, these are the most vulnerable members of our state right now. They've had no federal help. They are frontline staff. They are doing so much important work in all of our communities. And so I'm really excited that we are taking this bold step to protect and give back to taxpayers what they are putting into the system.
Well, let's be clear, it's $6,000 or less taxable income. So they may be filing a return, but those folks are not paying any income tax at the net end. And I will also say, if they should not be employed here, if they're working here, if they're here illegally. I understand.
We know the reality.
We don't want to turn anybody away to food bank.
They are employed and they're paying property taxes, they're paying income taxes if they're W-2 employees. Many of them are 1099s and they're filing 1099s and paying taxes. They pay sales taxes like you and I do. They pay taxes in numerous ways, just like you and I do every day, and yet they don't get the benefits.
But they're not. We didn't force them to be. We're not forcing them to be here though either.
Our thanks to Senator Reedy and Delegate Learman. Joining us now for the Political Roundtable are Bruce DuPoit of MarylandMatters.org and MPT's Sue Copen. Thank you for being here. Bruce, you wrote a story this week that the game, I shouldn't call it a game, the process of political redistricting that everybody in politics looks forward to may not happen this calendar year as expected.
That's exactly right, Jeff. And as you indicate, political junkies like Sue were hoping that the Maryland legislature would convene this fall in a special session to redraw state legislative boundaries and congressional boundaries, new maps that the state would then use over the course of the next decade, the next 5 election cycles. There's nothing like a special session for drama, and the political intrigue surrounding redistricting, of course, is second to none. But to do redistricting, you need the data, you need the numbers. How has Maryland changed over the past 10 years? And the Census Bureau has announced that we won't be getting that data until late September. It was originally supposed to be next month. And the delay, according to everyone that we've spoken with, means that this process of line drawing in Maryland will not take place now until lawmakers reconvene in Annapolis next January. So add that to the 2022 to-do list.
Of course, there are a couple of complications here, not the least of which is the governor has kind of gone his way because he's appointed this bipartisan body to draw their own lines. And then, Bruce, as you pointed out in your article, which I think is critically important, is the filing deadline for the primary is very quick into the legislative session. So the work period is really tight.
That's a great point. So the primary for the 2022 elections is late June of 2022. The filing deadline to get out to be a candidate in that primary is in late February. So as you indicate, Sue, it's a very tight window now for the legislature. It essentially means that they have to come in almost mid-January. I believe it's going to be the 12th. And then they have to go through the very difficult and contentious process of drawing boundaries that can then be used in a relatively short period of time.
Well,
with software, yeah, go ahead, Jeff, sorry.
I was trying to think of a good pivot, but I don't have one. The thing that most Marylanders are focused on right now, which is where to find a COVID vaccine. The governor's office announced today that the state has now given out over 1 million shots, but we have 6 million Marylanders and a lot of people who still want it. They're all continuously refreshing the website. What's your experience been? Where do things stand?
Well, it's a very frustrating process for a lot of people. And the state and the counties are trying to move as many vaccines into the field as they can, as quickly as they can, but they're also trying to prioritize people deemed most at risk.
The Oversight Committee, which is holding weekly hearings and hearing from the acting Secretary of the Department of Health, is very interesting. And Bruce and I were talking about this. Among the things that they continue to mention is they're concerned that the state, and I just deals with the state side, but this would have application to the other sites as well, may not be checking to be certain that those people who are coming in to get the COVID vaccine really belong in the groups that they claim to, and that they're coming from the area that they're supposed to represent. And one of the senators who's from the Eastern Shore made a point of saying that because they have their number of doses are considerably smaller because the counties are smaller, but by the same token, they have folks coming in from Delaware who are taking vaccines that the local residents otherwise should be getting.
A lot of concerns as well from maybe older folks who aren't quite as skilled with computer usage, about using computers, navigating some websites, trying to elbow your way through the digital crowd. There was going to be a state phone bank opened. I thought it was this week, but at our taping time, I haven't heard that yet.
I saw a number that has sort of replaced 211, so to speak, that is being rolled out that people can call for information. I don't believe it's a sign-up number, but the initial advice was call 211. That system was quickly overwhelmed by the volume of calls that then came into 211, so they've morphed to this new system. There simply aren't enough vaccines anywhere right now to meet the demand. And number two, and this goes to your point from a moment ago, Jeff, you have so many people who are forwarding the links that they receive to a friend or relative, perhaps benignly, thinking that they're helping that person out, but what they're really doing is creating enormous problems when people then use that forwarded link that wasn't intended for them to get what they think is an appointment. They show up and they're not who the local health department or the clinic or whoever wanted them to be from an equity standpoint or from a prioritization standpoint. So
Bruce,
that forwarding of links has been a big problem.
I have about a minute and a half. I know you were both on the Senate President's virtual gaggle with the press. What were the takeaways today?
Well, one of the items that they asked him about was the federal lawsuit that's being filed against the new digital tax that the governor vetoed and that the legislature overrode the veto. The claim is that it is unconstitutional, among other things. And Senator Ferguson said he's disappointed, but they obviously have their right to a day in court. He said, because they were asking about the money that they expect to get from this to help cover the cost of the education. And he said, well, that money has not really been accounted for right now, which is really a critical point because it's not in the budget for this year. And he said, in fact, for the out years, it hasn't really been accounted for. So we can wait until the litigation has been resolved before they can account for that, assuming it goes the state's way.
And Bruce, just
The
time
other
for a
big thing-
second on the workload, I guess.
Well, and I was going to say the other big issue that came up dealt with all of the law enforcement reform and the police reform legislation that the Senate Judicial Proceedings Committee and House Judiciary are wrestling with. Tempers have really flared in Annapolis, and I think emotions are pretty frayed in the committees where that work is moving forward. And you know, there's a concern that Washington-style politics is coming to Annapolis as people grapple with issues that have. That to a certain extent have been challenges that have been generations in the making.
You can read Bruce DuPoit's work at marylandmatters.org. Bruce and Sue, thank you very much. Have a good weekend.
Good to be with you.
And that is State Circle for this week. Thanks for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.
Programs on MPT are made possible by our members and the following.
What's your next move? Extend beyond your current position or make inroads into a new field through UMBC's professional master's programs and certificates in systems engineering, integrated product development, technical management, and more. Claim your future at UMBC.
Every month, the Weisenwell Center offers a wide variety of virtual classes that will keep you active, engaged, and social this winter. For more information, visit chooskeswick.org or call 410-662-4363.
71 acres in downtown Baltimore devoted to learning, discovery, care, and service. We train the professionals who secure the health, well-being, and just treatment of Maryland citizens. We create the knowledge that cures disease and strengthens communities across the state and around the world. UMB makes the world more just, more enlightened, healthier, and more humane. We are UMB.
Next time.
We have arrested a man.
The prime suspect in a teen's abduction is in custody.
I want to go to a police station. I want to see a solicitor.
But they're too late.
Looks like she was killed with a stab to the back of the head.
And Fulcher's gamble.
You think I did it? I know you did it.
Could jeopardize the case.
Would you agree, Mr. Hallowell, that these conversations took place?
No comment.
He's confessed to 2 murders.